Hello and welcome to Lesson 4. I'm Amy Jerum. I am the Pediatric Specialist with the Golisano-Institute for Developmental Disability Nursing at St. John Fisher College in Rochester, New York. This lesson, like the three that came before it, are for direct support personnel or family members of people with IDD. This one focuses on the unique considerations for people who have disabilities. The things that we should keep in mind as we work with and provide care for individuals with IDD. Let's get started. Our objective for this model is to Our objective for this module is to identify strategies that we can implement in community-based congregate care organizations, places like a group home or a nursing home. These strategies are aimed at reducing the spread of community-acquired illnesses, like the common cold, flu, RSV, or even COVID. The important things to consider as we go through this module are thinking about things like hand hygiene and how important it is, trying to limit contact with anyone who has illness symptoms, thinking about grouping residents with illness symptoms in some way within the house to keep people safe and not expose them unnecessarily to illnesses. You could also try to keep staffing consistent so that people who work at the group home or nursing home are providing care to the same residents for several days whenever possible, so that you're not having a lot of people in contact with each other. And it's also really hard to keep track of the spread of illness when there are a lot of people and a lot of variation in staffing. I'd like you to think about using surgical masks when you're caring for somebody who's sick. You can use a specialized surgical mask like an N95 mask when you're doing aerosol generating procedures, or if somebody is having a treatment that makes them cough a lot, that sort of thing. Otherwise, a regular hospital mask is just fine. We also want you to think about your PPE, your personal protective equipment, like your gloves, your gown, your goggles, or other eye protection. And there's strategies to extend these supplies, mostly thinking about things like cleaning your protective eyewear or using gowns that can be washed rather than paper ones that have to be thrown away. Thinking about things like that to really extend your supply. Let's go back to our case study. Jenny had a few days off. It turned out that she did not come down with any illnesses, nor did anyone in her family, but she did have to stay safe for a few days just to make sure everything was okay. She got back to work after a few days, and there were some new guidelines and protocols that had been put in place at the group home. The first guideline that she learned about and learned that was incredibly important was the recommendations about washing hands. There's times when it's really important for residents to wash hands, and there's times when it's very important for staff to wash their hands. Sometimes it'll be the same times, and other times it's a little bit different. But let's take a look. So when we think about the hand washing guidelines for the people who live in the residence, we want to encourage them to wash their hands before they eat or before preparing food. Everyone should wash their hands at that time, as well as when you leave the bathroom. After touching somebody else, you might see residents who hold hands or high five, something like that. And the same thing for the personnel. We want to be able to wash our hands for sure after that. After sneezing or blowing our nose, whenever they're soiled, of course. And then for DSPs, we also want to think about washing our hands before and after we provide care to a resident, things like personal care or helping them with a task or an activity of daily living. If we touch something, if we take out the garbage, when we first enter the house or just before we leave the house, when we put on or take off shoes. Take a minute and think about other times where it might be important to wash hands in your setting. You might have activities that you do that might be different, but it might be your responsibility each time you're in the house and might require hand washing before or after. So be thoughtful about that too. Jenny's continued to help implement the guidelines that were recommended by the CDC and work with the residents to have these things done in a way that was pretty easy and not traumatic or stressful for them whenever possible. One of the things that Jenny really took into consideration was the recommendation for physical distancing, also called social distancing. 6 feet of physical space between residents is a lot, and it's required for many activities and as often as possible, actually, within the group home. Now remember, these are individuals who live together. They're often really close friends. It's like having a family. So telling people that they can't get too close to one another can be really difficult. The other thing that's difficult is that all the residents were required to wear cloth face masks when not in their room to minimize touching their own face and their mouth. It was okay for some residents, but Danny in particular, who is a boy with autism who lives in the home, he got really upset and kept pulling his mask off of his face. The mask bothered him. He didn't like having something on his face, and it was upsetting for him to wear. He got frustrated and upset. He started hitting his head against the wall. He doesn't always have a way to express himself with words, but these behaviors are known to Jenny and the other staff, and this is the kind of thing that Danny does when he gets upset. So Jenny worked with him and went slow, starting with just touching the mask, then having him hold it in his hand. He was okay holding it and walking around with it. She even had him, kind of bring it up to his face and just feel it on his lips for a moment. So, this is going to take some time and desensitization, but it's possible that Danny could progress to wearing the mask. But realistically, Jenny knows that this could take a lot of time and may not be possible. Danny may really be resistant to wearing a mask because it really bothers him and it kind of triggers him in a sensory way that makes it really hard for him to cope. Jenny's also in charge of taking everyone's temperature every day that she's at the house, making sure that everybody is healthy and doesn't have a fever. She also assesses each resident for signs and symptoms of illness. All staff are required to wear masks in the house as well. Jenny's been assigned to 4 of the 8 residents, and she will care exclusively for these residents whenever she works, just like her other coworkers will exclusively care for the other 4 residents. So in this way, we're trying to kind of cohort people together, and that limits their exposure to one another. So a lot's changed over the last week at the group home and for Jenny and the residents. She thinks back to some of the things that have changed and that she's learned. But at the end of the day, Jenny knows the most important thing that she or anyone else can do to protect themselves and the other residents is to wash hands often. It seems simple, but it's very important. Next, we're going to do a brief quiz and just go through some of the key takeaway points from the course. I want you to take your time and think about these as we talk through them. And we'll also talk about which answers are correct. Hand washing being the most important thing that we can do to prevent the spread of illness is something that Jenny knows. She knows the primary purpose of washing her hands is it to remove all the germs from her hands? Is it to prevent the transmission of germs? Is it to leave a protective film on her hands that kills germs? Or do you think it's to minimize exposure to germs on sinks, medication containers, and other hard surfaces? The answer is B, to prevent the transmission of germs. We want to try to minimize how these illnesses spread to keep people healthy. You'll recall that Amy, one of the residents, was hospitalized with COVID-19. She recovered well and is back at the house. Jenny knows that the first thing she can do to be prepared is to apply personal protective equipment before caring for a resident. What's the first type of PPE that she should be thinking about? In thinking about transmission of illness and minimizing the risk of having a poor outcome for somebody who might be more vulnerable to COVID, who do you think the resident of these four choices would be the one that Jenny might be most concerned about and really, really be extra careful about not transmitting illness? Could it be a 23-year-old with autism? The 18-year-old who has Prader-Willi and asthma? How about the 69-year-old resident who has Down syndrome and COPD? Or perhaps it's the 69-year-old resident who has hearing loss and Tourette's. What do you think? The correct answer is C, the 69-year-old resident who has Down syndrome and COPD. This resident is over 65 and has a chronic condition, COPD, and also a comorbid diagnosis of Down syndrome. So this is somebody that we would want to keep a really close eye on for any symptoms of illnesses, and also really work hard to prevent the transmission of illness to somebody like this who might be more vulnerable. The next question is about PPE, our personal protective equipment. Jenny knows the first thing she'll do when preparing to apply some sort of PPE before caring for a resident with COVID is to do what? Should she wash her hands? Should she put on a gown first? What about clean gloves or applying her protective eyewear? The answer is A. Before applying any PPE, a DSP should perform hand hygiene. During one of her shifts at the group home, Jenny's working with one of her colleagues who's also a DSP. What statement about PPE made by this other DSP is incorrect? Is it, when in doubt, I wear gloves? Or is it B, I really dislike wearing a mask, so it's the first thing I take off? Or C, I always do hand hygiene when doing hands-on care for any resident? Or D, I wear gloves, a gown, a mask, and a face shield whenever I care for a resident who has a new cough? Which one of these is incorrect? It's B. This statement, I really like wearing a mask, I really don't like wearing a mask, so it's the first thing I take off. It requires some follow-up because gloves should really be rolled into the gown and removed first when wearing PPE to minimize the chance of contaminating the mask and your face. This is along the same lines as our last question. When removing a gown worn as PPE while caring for a resident who's in isolation with illness symptoms, why does the DSP roll the gown and remove the gloves at the same time? Is it to make sure the gown can be reused? Is it to protect the clothes or the uniform that the DSP is wearing? Is it to prevent touching contaminated materials with unprotected hands? Or is it to fold the gown correctly for reuse by the same person? What do you think? The correct answer is C. The DSP should avoid touching the outside of the gown to ensure that an ungloved hand does not touch a contaminated gown. Jenny's being careful to watch all the residents for any signs or symptoms of illness. Jenny knows that signs and symptoms of difficulty breathing are A, coughing, B, confusion, C, increased phlegm production, or D, red swollen tonsils. The correct answer is B. The new onset of confusion is a sign of difficulty breathing. It indicates that not enough oxygen is getting to the brain. This is something that is very important to be aware of and to assess for when working with residents, particularly if people don't communicate in the ways that we're used to when somebody is not feeling well or having difficulty breathing. Jenny's alert to the signs and symptoms of a fever. And she knows that these signs and symptoms are increased flexibility, an increased appetite, coughing, or having chills. D is the correct answer. Chills are one of the signs of having a fever. It wouldn't be uncommon to see somebody shivering or complaining of being cold if they actually are quite warm and have a fever. This isn't uncommon, and it's something that we should be watching for with the residents. That's the end of the module. Thanks so much for working with us and taking this journey. I hope that you really learned some useful tips, things that will help you keep you safe and the people that you care for healthy and safe. And just in case you haven't heard it lately, thank you. Thank you for what you do. You provide care in our community for people who are vulnerable and people who really deserve to have So that's the end of this module. Good job completing the course, and thanks for taking this journey with us. We really hope that you've learned some useful tips to help keep you and the people that you care for safe. And if you haven't heard it lately, thank you. Thank you for what you do. As you care for our community, we hope that these tips will help you care for yourselves and them during the illness season and always. Thanks again, and best wishes to you all.